Sure. My name is Mimi DeJaneiro. I'm a licensed clinical social worker and the bereavement training supervisor with By the Bay Health. Yeah, we've recently rebranded our name to By the Bay Health, and we were previously known as Hospice by the Bay. Our agency is over 45 years old, and now we're an affiliate of UCSF. So our agency provides hospice and bereavement care, as well as palliative care, home health, and pediatric care in the San Francisco Bay Area. Our population in the bereavement department is primarily adults of all ages, some teens and children. Our mission is to provide compassionate, client-centered care, and we're currently accepting applications for our bereavement training program, which provides the grief counseling to the loved ones of the patients who have died on our service. Currently working remotely and conduct all of our sessions either by Zoom or telephone. And our trainees and interns provide one-to-one grief counseling, as well as they facilitate the grief-related workshops and support groups. Examples of workshops and groups might be mindfulness in grief, expressive arts in grief, parental loss groups. Trainees also conduct supportive telephone outreach and do the intake assessments by phone with bereaved individuals who are seeking services from us. Beyond the client work, our trainees and post-grad interns are responsible for documenting an electronic medical record, for tending various administrative tasks, such as keeping the group registration log current, and for attending all the staff meetings, including our in-service trainings. So family members and loved ones of our deceased hospice patients are entitled to no-fee bereavement services upon the death of the patient. So bereaved family members will call into our bereavement department and ask for services. They're then scheduled for a 20-minute phone intake, which is an assessment, to assure that our services are appropriate for their needs at this time. And then if so, they're assigned to one of our bereavement counselors. It really varies, and it depends on the trainee's capacities and also on our client census. So I would say it varies, and say for a trainee who works 20 hours a week in practicum, they might have a caseload between 18 and 20. But bereavement clients are not seen weekly the whole time. Initially, when they're most acute in their grief, they are seen once a week for perhaps a month or so. And then they start to stretch out their sessions to perhaps every other week or even every third week. What we're trying to do there, because they have access to up to 20 no-fee grief counseling individual sessions, we're trying to stretch those out so that there's a few sessions that remain around the 1-year anniversary of the patient's death. Yeah, so I would say between 18 and 20 cases is typical at any one time. So we offer 1 hour of weekly individual or triadic supervision. And then in addition, there's 2 hours of weekly group supervision. And, you know, upon completing our year with us, we do ask the trainees and the interns to complete a satisfaction survey for their internship experience with us. And hands down, folks say over and over how meaningful the weekly group supervision is, not only for the training, you know, and doing case presentations with each other, but mainly for the support and encouragement they receive from each other. And people will share interventions, what worked well, what didn't work so well. So it's a lovely supportive environment. So initially, there's a 1-month initial orientation and training for the new bereavement trainees. And that's where they're introduced to the larger agency. They get to meet with our CEO and other department managers. They're given detailed, and then after that first week of orientation, general orientation, and they might be in orientation with nurses, with spiritual support counselors, with social workers. But that's kind of the overview that first week. And then for the remaining 3 weeks, they're in intensive training around how to provide bereavement services. And then beyond that, we do offer once a month in-service trainings, and we do different topics. For example, mindfulness and grief. We did one on mindfulness and grief. We've done one on the End of Life Option Act, which utilizes aid in dying medications in the state of California, and substance abuse and grief and trauma and grief. So those are some examples of some of the specialized in-service trainings, and those happen once a month. I would say that a trainee who feels drawn to be a compassionate witness to another human being suffering around the loss of their loved one, as well as someone who is fairly detailed oriented and can manage various administrative tasks. So it's kind of right brain and left brain, right? That's the kind of trainee that will thrive in this placement. So initially, trainees may find the extensive agency and departmental protocols and procedures a bit daunting. However, they're given a great deal of training and support, and typically end up really appreciating that procedures have been so thoughtfully laid out, and they serve as really helpful guides to accomplishing a pretty high standard of care for our clients. You know, just that we really appreciate CIIS students in particular for the curriculum and the training the school gives you. And we've always found that our CIIS students and grads tend to leave legacy pieces with us. And I'll give you an example. There was a graduate of your program there who did a workshop called Collage and Grief. And it was a 1.5-hour workshop where bereaved individuals came in and they did collages that either honored their loved one or represented their own grief journey. And it was so beautifully received. And when that intern completed with us, she actually stayed 2 years with us. That workshop remains as one that we might decide to pull out and offer at another time. Yeah, so I'd invite you to go onto our website at bythebayhealth.org and learn more about the bereavement services that we offer, because much of what you'll see listed there is facilitated by our interns and trainees. And then if you're interested, please apply online there at bythebayhealth.org.